T1, T2 level, so that should be stable all the way. Come toward me, all the way. So this is the beginning of your test on this. I'm gonna do the basic movements first, okay? And I'll do the top one. So passive movement, allow me to move your neck as far as I can. Let me know if there's any pain, okay? Don't help me at all. So I'm just gonna move it forward. Flexion. I'm gonna move it down. See how I'm in a neutral position again, and just drop, because I want pretty much everything. Open your eyes first. So I want to be able to see if there's anything happening with this movement. And then rotate. She doesn't like this. Little step. And then rotate. So you can use your hip. You feel like your patient feels a lot more stable that way. And then side bend, and then side bend. There's 3 ways to do this. I'm going to show you the chin cradle grip in the handout. Maitland technique, and I like to do this on my patient because they feel a lot more comfortable. So I'm going to be using my forearm as a little pillow for my patient. So this is rotation to the right, rotation to the left. You could use your shoulder, chest wall to push your patient forward, and then back. Don't look at your patient's eyes. It's gonna get awkward, right? Because it tends to happen all the time, happen to the best of us. Probably like it just started looking at me and it's gonna be weird, okay? So that's technique number 2. Christian, can I borrow your stencil, please? James, you have your, I'm gonna click, okay? Sorry, thanks. Thank you. Sitting position. And we're gonna show you the AO, C1, C2 in sitting too. So sitting, as far as you can, relax, don't help me. Passive, flexion, open your eyes. Ideally, I like to do this with a resting position of my TMJ. What is that? So I'm just going to ask my patient to just put your palm in the soft palate, okay? And then that way. That way. And then side bend. And then side bend. And if I want to do my, come down, I'm going to put your head resting at the table. If I want to do my atlanto-occipital joint, C1 and then the CO, all I have to do is just this. So what test is this? It's cranial-cervical spine flexion testing. Very similar. So you're just sliding that patient's posterior head and occiput towards the table. So this is your contact, not here. I've seen a lot of this because it's gonna be weird. So I like the contact on top of the ear and then mastoid process, and you're almost like doing this. Okay? So I have that ulnar and radial deviation. So upper cervical spine flexion, upper cervical spine extension, without lifting the occiput of your patient. Flexion, and then extension. Okay? So practice those and then we'll show you